Buenos días, buenas tardes, buenas noches, bonjour, bon après-midi, bonne nuit, bon dia, boa tarde, boa noite, good morning, good afternoon, good night to all of our attendees here at the Jamaica Convention Center, as well as to you, the viewers who might be watching from YouTube, Twitter, Hopin, and the RP21 webpage. I am Dr. Reed at your service as main host. Now, welcome, bienvenido, bienvenue, bienvenido. This is the fourth and final day of the 7th Regional Platform for Disaster Risk Reduction in the Americas and the Caribbean, or RP21. The very apt theme, building resilient economies in the Americas and the Caribbean. We are coming to you live from downtown Kingston, Jamaica, and I must say that on behalf of the government of Jamaica, we are pleased that Jamaica is the host country for RP21, the very first time that a Caribbean country has had the honor. So we just would like to acknowledge the organizers and the convening bodies who made this entire thing possible. The Ministry of Local Government and Rural Development of Jamaica, the Caribbean Disaster Emergency Management Agency, or CDEMA, the United Nations Office for Disaster Risk Reduction, UNDRR. We'd also like to acknowledge our other partner groups as well as donors, in particular, the U.S. Agency for International Development, Bureau for Humanitarian Assistance, USAID, BHA, the Swiss Agency for Development and Cooperation, SDC, High Commission of Canada, Government of Canada, Climate Risk Early Warning Systems, or CRUIS, the European Civil Protection and Humanitarian Aid Operations of the European Commission, ECHO, German Agency for International Cooperation, GIZ, and Jamaica National Group, JN Group. Thank you so very much for your contributions, and of course to all the moderators and all the speakers who have contributed over the last 4 days. We're going to jump right into our high-level session, and we do invite you to use the hashtag RP21 and all the other hashtags that are related with this event. So the first high-level session, HL4, is titled Strengthening Disaster Risk Governance, Lessons from COVID-19, and I'm sure there are many. The organizers for this particular session are the Pan American Health Organization, or PAHO, the United Nations Office for Disaster Risk Reduction, UNDRR, the United Nations Programme for Development, UNDP, the Global Network Civil Society Organizations for Disaster Reduction, GNDR, and the Coordination Center for the Prevention of Natural Disasters in Central America, PREDENENAC. The moderator is Dr. Alan Lavelle, Social Risks and Disasters Program, Latin American Faculty of Social Science Faculty, Flasco, Costa Rica. Please do enjoy.
Good morning. I am Alan Lavelle, and as the presenter previously said, I am an associate researcher at the Latin American Social Science Faculty in San Jose, Costa Rica. I will be your moderator for this session, which will last an hour and a half. I will speak predominantly in English, given that a good part of the session will be in Spanish, so we can divide up the languages between the two. I may speak in Spanish where it is appropriate for the person who has to listen to what I'm saying to understand fully what is being said. Let me first thank the audience. Let me thank the organizers who were just mentioned, and I will not repeat for the sake of time, your presence in this high-level session on strengthening governance for disaster risk and taking into account the lessons from COVID. I will begin now, prior to outlining the structure of our session, just to give a little bit of background information, which puts in perspective the discussions we will be having today. COVID has been with us now for 2 years, and we all know of its intense impacts on health, society, economy. and the debates which now occur as to changes needed in society to avoid this type of event in the future. The event as such has been categorized as a systemic disaster, the result of the construction of systemic risk conditions in society. Such systemic risk has come to the forefront in our discussions in the disaster risk management area since predominantly the financial crisis of 2008, and has been added to by such things as climate change, the Fukushima disaster, the Sandy impact on New York, and many impacts in the Caribbean through Maria, Irma, etc. So the systemic nature of risk, which has always been with us, is increasingly highlighted. Our governance structures have in many ways been built up accumulatively over time as new preoccupations come to mind. And we have had more recently the whole discussion on resilience, which is still there. Systemic risk and systemic risk governance could be seen to be the latest of the preoccupations, and which require a close look at our governance structures, our normative behaviours, our laws, our organisational structures, the intersectoral relations we have, the relations between international, national, regional and local levels of intervention and down to the community level. And consequently, COVID gives us a chance to do that with a very clear example of a systemic risk disaster or catastrophe in the search to identify lessons, identify how COVID has unrevealed or revealed things we knew before, but which come to mind far more glaringly now because of the impact of this major global event. And so what we have today is a series of presentations, and we're very privileged to have the presence of 6 highly qualified professionals who I will introduce as we go through the programme rather than right at the beginning. I will not present their curricula vitae in detail. These can be consulted on the platform. I will just give a brief introduction to who they are, where they are and what they're doing nowadays, and a little bit about their experience over the last years in which they've been involved one way or another in this topic. We're very fortunate to have representations from different areas of knowledge and areas of action that obviously should interact between themselves in the search for better governance response. And those come from the health area, where we have 3 professionals, from the disaster risk management or emergency management areas, where we are represented by regional and national bodies. And we also have, very importantly, because of the systemic nature of risk and its birth in development processes, a representative from development planning, development economics, which is so important for the consideration of what we're calling prospective risk management. That is not dealing with risk when it is actualized in disaster or trying to correct risk conditions that already exist. It is the idea of, by challenging and changing our development practices, avoiding that risk is constructed in the first place. We cannot afford another COVID with all of the cost of response, preparedness that is involved. We must move toward governance schemes that do in fact open up the possibility of reducing disaster risk at the different levels in which it is expressed. Finally, in this brief introduction, let me just give a run through the structure of our session. When I finalize, I will pass the word to Dr. Ciro Ugarte Casafranca, who is the Director of the Health Emergencies area in the Pan American Health Organization, where he has been working for the last 20 years, and I have known him for the last 30 some odd years in the practice of development risk management from a health perspective. Following his intervention, which will last 7 minutes, I will ask Alex Camacho from PAHO to introduce the Slido concept, which is the way in which questions will be formulated by the audience and transmitted to our participants. Following that, we will then move into the session of 5 speakers on different topics The topics they will be talking about are guided by questions that were asked them previously, which I'm not going to repeat in the interest of time, but you will see from the organisation of their responses, they respond to different concerns as regard governance structures in Latin America and the Caribbean. We have good representation from Latin America and the Caribbean, from the South, from Central America, and 2 Caribbean islands, etc. Following their intervention, that will be wrapped up by myself. We will then pass the word to Alex Camacho once more to initiate the whole question and answers part of it. And then I will pass the word to Mr. Vijay Kumar from the Global Network for Civil Society Organizations for Disaster Risk Reduction to give the closing comments and talk. So with no more ado, let me pass the word to my close friend and colleague, Ciro, to give 7 minutes, and I insist on the 7 minutes as being British, of each of you, such that we can maintain the time for questions at the end. Thank you very much.
Muchísimas gracias, querido Alan. Es un gran placer compartir esta sesión de alto nivel con tan distinguidos y distinguidas panelistas profesionales de muy alto nivel con una responsabilidad esencial en la gestión de riesgos. Queridas y queridos participantes, en los últimos 20 años, sin considerar la pandemia de la COVID-19, cerca de 3.000 desastres ocurrieron en la región de las Américas y el Caribe. Y los fenómenos naturales fueron el origen de alrededor del 73% de ellos. Esos desastres cobraron cerca de 300.000 vidas y afectaron cerca de 280 millones de personas. Se estima que hubo un impacto de 1.3 billones de dólares en daños. Pero desde inicio del año pasado hasta el 3 de noviembre, hasta ayer, se reportaron más de 247 millones de casos de COVID-19 y sobrepasamos las 5 millones de muertes por esta enfermedad a nivel global. Hasta el momento se han administrado cerca de 7 billones de dosis de vacuna contra la enfermedad. Pensamos que cuando discutíamos el marco de Sendai y tuvimos sesiones con la mayoría de los sistemas de gestión de riesgos en Sendai para la incorporación de temas de salud en el marco de Sendai, habíamos aprendido la lección del brote de ébola del 2014. Y se incorporaron más de 30 referencias en aspectos de salud, incluyendo aspectos relacionados con epidemias, con sistemas nacionales de gestión de riesgo de desastres, el Reglamento Sanitario Internacional y muchos aspectos en todas las fases de la respuesta a epidemias y pandemias. Específicamente, la prioridad 2 del marco de Sendai establece la necesidad de fortalecer la gobernanza del riesgo de desastres. Todavía no hemos incorporado adecuadamente los temas de epidemias y pandemias como parte de la gobernanza del riesgo de desastres. Y la pandemia de la COVID-19 nos ha mostrado que este punto debe ser abordado sin demora y con un enfoque de todo el gobierno, de toda la sociedad y de todas las disciplinas. Aquellos países que han priorizado la coordinación intersectorial, el marco legal, la política y los planes, la información de riesgo actualizada para impulsar la toma de decisiones y los mecanismos claros de participación e integración desde el nivel nacional, regional y local, han tenido mayor éxito en el control de esta pandemia. Pero sigue siendo compleja y estará con nosotros, lamentablemente, durante varios meses más, hasta que la vacunación llegue a niveles de protección y la transmisión se reduzca a niveles de seguridad. La detección de la enfermedad no fue nuestro mayor problema. El mayor problema fue y sigue siendo la dificultad en medir lo que está pasando. En lo que al inicio pasaba con el fallecimiento de las personas adultas mayores en centros de cuidados, y también con la disponibilidad y la distribución y la cadena de suministros y equipos esenciales para la protección de los pacientes, del personal de salud y de la población. Esto aún no ha sido resuelto. Y además, el monitoreo de todos aquellos programas sociales de beneficio y de protección a la sociedad y a la población, incluyendo los de salud. Sabemos, y lo sabíamos, que toda emergencia sanitaria tiene implicancias políticas, económicas y sociales. Mientras más grande es la epidemia, más se necesita la interacción de los más altos niveles de decisión de los países, la incorporación de los sistemas nacionales de gestión de riesgo y de la sociedad civil en todos sus ámbitos y manifestaciones, incluyendo los ámbitos profesionales, académicos y comunitarios. El sector salud es un elemento clave en la respuesta, pero solo podrá ejercer sus funciones y controlar en medida conjuntamente la pandemia con el trabajo de todos los sectores, especialmente aquellos que tienen responsabilidad en la gestión de emergencias y riesgos a nivel nacional, subnacional y local. El concepto de riesgo sistémico hace énfasis en la necesidad de comprender y gestionar las variables de riesgo independientes y multidimensionales que se crean y magnifican entre diferentes sistemas a medida que interactúan a través de diferentes escalas geográficas o espaciales. La COVID-19 nos mostró que una emergencia que empezó como un brote ahora afecta a todos los sectores socioeconómicos y niveles territoriales, desde el nivel local hasta un impacto global que todavía está siendo analizado. La gestión prospectiva del riesgo requiere que los sistemas nacionales y los gobiernos revisen y actualicen sus políticas, regulaciones e incentivos fiscales que regulan y configuran el desarrollo. Es necesaria la interacción adecuada. Voy a enfatizar este tema. Interacción adecuada entre todos los sectores con vínculos intersectoriales, incluyendo mecanismos de incentivos y oportunidades prácticas de colaboración. La gestión de la información sobre los riesgos no es propiedad de un sector o de un área, es propiedad de toda la población y por tanto requiere un enfoque de amenazas múltiples y de interacción hacia una nueva generación de sistemas de alerta más eficaces, conjuntas y eficientes. La integración del riesgo de desastres en la planificación de desarrollo no puede ser aún más importante. El reporte de avance de la implementación del marco de Sendai muestra un logro marginal en los indicadores en la región, principalmente en los relacionados con la gobernanza del riesgo de desastres. Los efectos de los desastres todavía serán devastadores. Necesitamos focalizar los esfuerzos en acciones dirigidas al fortalecimiento de la gobernanza, en reconocer la importancia de la coordinación intersectorial e internacional sobre el riesgo de desastres y promover la participación plena y significativa de todas y todos los actores relevantes en los niveles apropiados. Solo así lograremos controlar esta pandemia que nos afecta a todos. Muchas gracias.
Thank you very much, Dr. Ugarte, for maintaining yourself exactly within the 7 minutes, which I was. I will now ask Alex Camacho to introduce us to the Slido instrument for the questions following this.
Gracias.
Following this introduction. Sorry. Carry on, Alex.
Gracias, Alan. Buenos días con todos. Uno de los retos de la virtualidad es justamente la interacción con el público y queremos que ustedes sean partícipes activos de esta sesión. Por lo tanto, les pedimos sacar sus teléfonos celulares, sus teléfonos móviles o a través de sus navegadores, ingresar a la página slido.com. Cuando entran a slido.com les va a requerir un código. El código es HL4, no importa si son mayúsculas o minúsculas. Y a través de Slido ustedes van a tener la posibilidad de realizar preguntas conforme los panelistas van desarrollándolo. De igual forma, ustedes tienen la posibilidad de votar las preguntas que ustedes más les gustaría que sean priorizadas y de acuerdo a las preguntas más votadas, al final en el segmento de preguntas y respuestas, ustedes van a tener la posibilidad de mirar justamente estos resultados de las preguntas más votadas y por supuesto también de que ellas en medida del tiempo sean respondidas. Les agradecemos su interacción. Pueden ingresar también a través del código QR que ustedes pueden apreciar en sus pantallas y les invitamos a interactuar durante esta sesión. Muchas gracias.
I'm sorry for the delay. Every time I have to change from Spanish to English and on my keyboard, and so I don't hear the Spanish or English translation in my ear. Thank you, Alex. Maybe I could ask you just to repeat once more the code for getting into Slido, the 2021 part of it.
Claro, Alan. Ingresamos entonces a slido.com, slido.com. Y el código es HL4 y pueden ingresar directamente también accediendo al código QR. Es importante mencionar para que aquellos que están conectados a través de Hopin, ustedes pueden en el segmento lateral derecho también poder mirar cómo va desarrollándose a través de la sección Slido que está en ese momento. Pero sugerimos usar su navegador. Gracias, Alan.
Thank you very much. With that, I think everybody should be sure of how to get into the Slido consideration. I will now pass over to the next substantive section of our high-level meeting, introducing one by one the 5 speakers who will be speaking for 7 minutes on a topic which has been directed by a series of questions asked previously to them, and which I will not repeat in the interest of time. Our first speaker will be Dr. Paula Dasa, Narbona, who is the Undersecretary of Public Health in Chile. She has an extensive experience at both academic and political level in terms of health emergencies, and other aspects of the health scene. And I'm very grateful and very glad to introduce Dr. Dasa for the first talk in this present session. Thank you very much, Doctora.
Thank you very much for your presentation. I will do my presentation in Spanish. So please, the first slides. Bueno, con respecto al fortalecimiento de la gobernanza de riesgo de desastres, lecciones, quiero saludarlos a todos ustedes. Un gusto estar hoy día acá haciendo algunos detalles acerca de lo que ha vivido este año, 8 meses en pandemia en nuestro país. Cada momento que nosotros hemos tenido durante este año, 8 meses, ha sido marcado por 2 frentes. Una gran incertidumbre porque estábamos frente a un virus desconocido y el dilema de cada una de las decisiones que hemos venido adoptando. Un virus desconocido porque sabemos en un principio, cuando no sabíamos con claridad cómo nos íbamos a ir contagiando, si era un virus sintomático, asintomático. También hay que recordar que se declaró pandemia el 11 de marzo del año 2020, cuando ya el virus estaba en muchos países, y finalmente también un virus caprichoso porque sabemos que va cambiando, muchas veces llegando a los distintos países sin saberlo. Pero también tenemos 4 certezas. 4 certezas que sabemos que le hemos venido repitiendo: el lavado de manos, el uso de mascarilla, el distanciamiento físico y la vacunación, que es tan importante porque salvan vidas. Y dentro de este contexto, nosotros hemos hecho un trabajo desde el día primero. El presidente de la República, en febrero del año 2020, decretó a través de su autoridad dos cosas legales que son muy importantes en nuestro país. Uno, se decretó un estado de emergencia que nos da atribuciones al Ministerio de Salud, tomar una serie de medidas para la movilidad de las personas, y también una alerta sanitaria que permite al Ministerio de Salud tomar una serie de medidas con respecto a restricciones y también a la vida de las personas. Y en ese contexto, todo el Estado, todo el gobierno, bajo la autoridad del presidente de la República, se orientó a la colaboración intersectorial en el manejo manejo de la pandemia. Y aquí, en honor al tiempo, algunos detalles: la colaboración intersectorial, el Ministerio de Defensa, el Ministerio de Prevención del Delito, orientado a la fiscalización. Tuvimos un trabajo muy importante con las Fuerzas Armadas en el apoyo del traslado de vacunas, en el apoyo del control de las personas para que resguardaran la cuarentena. También ha sido muy importante la colaboración intersectorial en el tema de la vacunación. Aquí vemos en estas fotos distintos ministerios: Ministerio de Relaciones Exteriores, quien hizo el trabajo de el trabajo a nivel internacional para hacer los contratos de las vacunas, también el Ministerio de Ciencias, que se manejó con las distintas universidades para poder tener evidencia científica, Ministerio de Salud y por supuesto que el Ministerio de Defensa para poder trasladar las vacunas. Y en ese sentido también tuvimos un rol importante de colaboración con otros actores. Aquí está el presidente con distintos actores. Tenemos actores de las universidades, tenemos actores dentro del Ministerio de Salud, el Ministerio de Ciencia, principalmente para el análisis de datos y poder tomar decisiones de manera oportuna. Lo otro que es muy importante definir, que la colaboración intersectorial incorporó también a medios, no solamente del punto de vista interministerial, todos los ministerios abocados al control de la pandemia. Estamos hablando del Ministerio de Economía para apoyar a las personas, para que implementaran los protocolos, el Ministerio de Hacienda para dar los recursos, el Ministerio de Ciencias analizando los datos, Defensa, el Ministerio de Cultura a través del desarrollo de distintas entidades para que llevara la cultura a las personas. El Ministerio de Educación tuvo un rol tremendamente importante para implementar los protocolos de educación en los niños. Por lo tanto, un país completo enfocado en este control de la pandemia desde sus distintas veredas. Acá es muy importante decir el rol que ha tenido las organizaciones civiles. Se hicieron acá, el rol de las organizaciones civiles fue un rol muy importante, porque es una de las preguntas: ¿cuál es el papel de las organizaciones civiles? Acá se creó un consejo asesor que participó muy importante principalmente en dar algunas recomendaciones. Son principalmente expertos del mundo académico, del mundo científico, del mundo de la sociedad civil. Creamos este consejo asesor para que todas las semanas nos recomendara, hiciera recomendaciones en el aprendizaje y en el manejo de la pandemia. También la mesa social que fue un componente muy importante a través de distintos actores, universidades, alcaldes, atención primaria, también actores de la sociedad civil, actores de los distintos ministerios actuaron en esta mesa social para llegar a las personas. Acá estamos viendo un rol muy importante. Desarrollamos cuadrillas sanitarias y me quiero detener acá en 30 segundos. La sociedad civil, organizaciones, dirigentes sociales, las cuadrillas sanitarias eran personas de la sociedad civil a quien capacitamos y quien iban a sus vecinos con el mensaje de autocuidado, con el mensaje de por qué era importante vacunarse, por qué era importante usar la mascarilla, cómo usarla. Hace pocas semanas atrás tuvimos una reunión a través de Zoom con más de 200 organizaciones civiles donde ellos nos daban a nosotros la riqueza de cuáles eran sus inquietudes, sus dudas de sus vecinos. Nos decían: nosotros hablamos de la mascarilla, cómo usarla bien, pero no hablamos de cómo eliminar la mascarilla. Ellos llegan y levantan la información y nos da. Las organizaciones sociales han tenido un rol tremendamente relevante a través de esta estrategia de cuadrillas sanitarias en tu barrio, cuadrillas sanitarias en tu escuela, jóvenes, alumnos, profesores que iban con el mensaje a sus colegios, distintos cuadrilleros que iban enfocados a sus lugares de trabajo también para poder ir con el mensaje y llegar con la comunicación de riesgo a todos ellos. Hicimos distintas jornadas de escucha. Aquí están las organizaciones civiles, universidades. El presidente siempre ha estado en un rol muy importante en esta pandemia y enfocado en el control. Colegio médico, universidades, académicos, alcaldes, todos juntos con un solo fin: el control de la pandemia para poder llevar una vida normal. Hicimos jornadas de escucha con la sociedad civil, jornadas que nos ha permitido llegar a todas las personas para levantar las dudas e inquietudes de todos ellos. Aquí tenemos las jornadas de escucha que yo les contaba, donde hemos podido llegar y escuchar a jornadas de escucha ciudadana, de escolares, adultos mayores y de salud mental, de distintas organizaciones que iban con este mensaje hacia nosotros. Bueno, muchas gracias y encantada de compartir esta reunión con ustedes.
So, following that, I have the great pleasure to introduce Dr. Simone Eza Beach, and I'm sorry if I pronounce names wrong. There is a very great difficulty in the English language of knowing how things are really pronounced. But I'm very grateful for your presence. Dr. Keza is the Chief Medical Officer at the Ministry of Health, Welfare and Environment. Very interesting combination of topics and very relevant in St. Vincent and the Grenadines. And she has been in that position since 2013, I believe, and has over near to 30 years of experience with emergency and accidental health issues in the island and elsewhere. The floor is yours, Doctor.
Good morning, everybody, and thank you very much for the warm introduction. And I would like to start my presentation. I'm very honored today to represent St. Vincent and the Grenadines on this panel. By the time the WHO declared SARS-CoV a pandemic in March 11, 2020, the multi-island state of St. Vincent and the Grenadines had developed a relatively strong foundation of national emergency management and health disaster management. The NEMO, the National Emergency Management Organization, had for more than 20 years developed and refined disaster plans and systems for the numerous hazards and vulnerabilities and risks associated with these islands, with an active volcano located in the hurricane belt. The NEMO had trained a large and varied cadre of responders, including EOC personnel and shelter managers and community disaster responders. The government of St. Vincent had established a disaster fund, locally resourced for taxes on hotels, to facilitate the financing of an immediate post-disaster response. In June 2019, extensive exercises as part of the Trade Winds 19 were held in St. Vincent, including the simulation of a volcanic eruption and an infectious disease outbreak in a shelter. Disaster risk reduction in the health sector had evolved. Sorry, not getting slides. Okay. Disaster risk reduction in the health sector had evolved and expanded to embrace the St. Vincent and the Grenadines Comprehensive Disaster Management Policy. The Health Disaster Coordinator with the Health Disaster Management Unit had been established in St. Vincent and the Grenadines in 2013, and the lessons of Hurricane Maria focus on our efforts to create health-resistant health districts in our multi-island state. The National Health Multi-Hazard Plan had been developed in 2019 with the requisite health assessments, risk assessments, and volcanic eruption, hurricanes, and pandemic were listed among the moderate to high risk of occurring. The highly infectious disease plan had been revised. In 2020, the Health Security Unit was formally established with the creation of the position of Director of Health Security. And the motto is, health security is national security. In 2020, January, under the USAID, an emergency supply chain capacity building workshop had actually taken place. Next slide, and next slide, please. A recovery on March 11, 2020, on the same day that the pandemic was declared in St. Vincent and the Grenadines, we recorded our first case of COVID-19, a Vincentian who had returned from visiting the UK. By then, the NEOC had been partially activated to support the National Emergency Operations Center, Health Emergency Operations Center, a multi-sectoral task force of health services subcommittee of the National Emergency Committee, chaired by the Honorable Prime Minister, who is also the Minister of National Security, was fully functional. Exactly 14 days later, the Prime Minister, the Honorable Dr. Ralph E. Gonsalves, addressed the nation on the monumental, multi-dimensional challenge of coronavirus and its consequences. the Prime Minister identified measures to be implemented to mitigate the impact of the COVID-19, the impact on interconnected health, economic, social, and security dimensions, the HES. These measures took into consideration the peculiarities of our Vincentian context and how we are impacted by regional and international forces. An economic recovery plan was put in place at that time. The total package of the fiscal stimulus and tax relief amounted to more than $70 million, or in excess of 3% of our GDP. Social support systems were instituted, which offered support to our vulnerable and affected persons so that we widened the social safety net. There were grants under the promotion of the Youth Micro Enterprises Program and small business supports. There was additional support to tourism and food distribution of locally grown foods in love boxes began, the aggregate of which amounted to $64.05 million. The Royal St. Vincent and the Grenadines Police Force and security apparatus of the state activated plans to strengthen citizen security. The importance of lives and livelihoods of maintaining economic activity was weighed against shutting it down tight as a drum. We never shut our borders or implemented a curfew or declared a state of emergency. Rather, a public health emergency was declared, allowing for necessary amendments to the Public Health Act, which supported the response to the epidemic. In March 2020, from March to December 2020, we were able to strengthen our collaborations with the various sectors. On December 2020 to February 21, we had our first major, next slide please, sorry. We had our first major spike of COVID cases. Next slide again. And in April the 9th, next slide please, we had the La Soufrière eruption, where we went into explosive eruptions and next slide, please, again, sorry. The entire national emergency system was activated. The principles of disaster management kicked in, and we were able to easily, successfully execute the volcanic eruptions disasters. The importance of risk communications was demonstrated by the general rejection, however, of most of the at-risk citizens, the shelterees, to accepting the COVID-19 testing and vaccination. Key interventions in the new COVID-19 component of the volcano response plan. Next slide, and next slide. Let's go to the end. We have learned through our experiences that there is need for a comprehensive disaster risk reduction to be integrated into all of our strategic plans. And as we stand now, we are rebuilding, we are recovering, and we are planning for our 9 mornings COVID style in St. Vincent and the Grenadines. Thank you.
Thank you so much, Doctor, for doing a wonderful job in a very short time in a very multi-hazard context, which is a very relevant topic nowadays, particularly for small island states in the Caribbean, which have a series of conditions and situations which many large countries do not face. So we will pass now to our next speaker, who is Claudia Herrera, who is the Executive Secretary of the Central American Coordinating Body for Disaster Reduction. It's a very pleasant for me to be able to invite Claudia, who I've known for a long time. She has an extensive experience in the topic over the last 20, 25 years, very significant in the development of Central American policy-making documents for the region as a whole over time, and also, and admirably, the first woman Secretary General or General Coordinating Secretary of CEPRELINAC since its foundation in 1989 for the Central American region. Claudia, you have your 7 minutes. Thank you very much.
Thank you very much, Alan. It's really a pleasure to be with you today. Gracias por la oportunidad para compartir los esfuerzos que venimos promoviendo para promover esta articulación de los diferentes actores de los territorios y la adaptación que los sistemas de gestión integral de riesgo y protección civil han tenido que ir desarrollando por la situación del COVID-19. Desde nuestra instancia trabajamos para promover, para coordinar y facilitar los procesos de gobernanza en la gestión integral de riesgo y así contar con marcos normativos que orienten y faciliten la implementación de una efectiva política pública para la reducción del riesgo, que contribuye sin duda alguna a definir instrumentos institucionales y presupuestales para desarrollar conjuntamente una gobernanza efectiva. Reiteramos que las mejoras en la gobernanza del riesgo de desastres conducen a la reducción de las pérdidas económicas causadas por los desastres y asegurar el bien más valioso que es la vida de las personas. Los esfuerzos que se han realizado en nuestra región nos han demostrado que la buena gobernanza tiene efectos claros y directos en la reducción de pérdidas y daños causados por los desastres. La política centroamericana de gestión integral de riesgo armonizada con el marco de Sendai establece que cada gobierno tiene la responsabilidad primordial de prevenir, de reducir los riesgos y los desastres a través de la cooperación, a través de la articulación regional y subregional apoyada por los mecanismos existentes. Durante las distintas emergencias que afectaron nuestra región, particularmente los huracanes ETA e IOTA y la pandemia del COVID-19, pudimos observar el fuerte impacto sobre la infraestructura económica, social y productiva. Vimos con claridad que muchas comunidades estaban prestas a tomar medidas para proteger la vida y así protegemos también este bien tan importante. Sin lugar a dudas, a través del desarrollo de estas estrategias será más fácil abordar y promover procesos de resiliencia comunitaria a través del cual podemos elevar la resiliencia también a nivel nacional. Para nuestra institución, las comunidades son las primeras que tienen que tener la capacidad para reaccionar ante las amenazas y deben de contar con capacidades que les permitan avanzar en este recorrido hacia la resiliencia. Por eso estamos desarrollando esfuerzos significativos para la construcción de una Centroamérica más resiliente, así como también otras acciones intersectoriales que ya voy a compartir. Como se ha demostrado, el riesgo es sistémico y es múltiple y los gobiernos locales, junto con las diferentes organizaciones y actores, tenemos que impulsar estas acciones que nos permitan funcionar y abordar estas características de forma articulada. Las estrategias de reducción de riesgo de desastres y la resiliencia deben ser interdependientes, deben desarrollarse en coherencia con otros marcos globales para abordar los riesgos múltiples de naturaleza sistémica y de escala diversa a los que se enfrentan cada vez más nuestros países y nuestras ciudades. Reducir la carga en la planificación, asignación de recursos y elaboración de reportes. Las estrategias de reducción de riesgo de desastres y resiliencia deben operar en conjunto con otros marcos de políticas incluidas en las iniciativas de adaptación y mitigación del cambio climático definidas por el Acuerdo de París, la nueva Agenda Urbana y la Agenda 2030 para el Desarrollo Sostenible. Quiero compartirles que desde nuestra instancia estamos promoviendo junto a la CISCA, la instancia de coordinación del aspecto social, el plan regional de la nueva Agenda Urbana, así como la aplicación del IGOV en cada uno de nuestros países. Hemos incorporado también indicadores regionales en el monitor de Sendai. Y estos son esfuerzos concretos que nos permiten ir midiendo también nuestros avances en la gobernanza del riesgo. Los sectores públicos y privados y las organizaciones de sociedad civil, así como la comunidad académica y las instituciones científicas y de investigación deben cooperar de forma articulada para integrar el riesgo de desastre en sus prácticas de gestión. Los medios de comunicación deben de desempeñar un papel activo e inclusivo, acciones que se impulsan de manera permanente desde el CEPREDENAC para lograr un desarrollo sostenible, resiliente y duradero en nuestra región. Nuestra política centroamericana de gestión integral de riesgo es el mandato regional de mayor nivel en materia de gestión integral de riesgo en nuestra región, bajo lo cual los países han desarrollado sus políticas y sus planes nacionales y se diseñan también estrategias específicas como es el Plan Regional de Gestión Integral de Riesgo con el fin de garantizar su aplicación en el territorio, el cual ofrece un valor agregado a los procesos que hoy se desarrollan en los países y en la región, fundamentalmente con una armonización e integración de los enfoques sectoriales. Puedo citar algunos ejemplos, ya señalaba la la nueva agenda urbana, pero también el plan de movilidad y logística, la política cultural, la vinculación con la política universitaria, la política de igualdad y equidad de género, que todas ellas se han abordado adecuadamente la gestión integral de riesgo, promoviendo una base territorial a nivel nacional más concreta y una puesta al día de los abordajes teóricos y conceptuales y una intensificación de las acciones de coordinación y promoción. Quiero compartirles que en el marco de la pandemia del COVID-19, la gobernanza del riesgo de desastres también nos identificó que este momento crítico que atravesaron nuestros países y los gobiernos en coordinación con el sistema de la integración centroamericana desarrollaron la plataforma de Unidos contra el Coronavirus, un plan de contingencia que fue adoptada por los jefes de Estado y que, a través de la cual se establecieron los pasos para el desarrollo de acciones conjuntas. Se declaró también las valoraciones y las acciones de prevención, contención y tratamiento del COVID-19. Y bueno, por cuestiones veo que estoy quedándome corta del tiempo, pero quiero resaltar esa acción intersectorial que fuimos designados junto a la Instancia Regional de Salud, Comisca, para desarrollar estas acciones de salud y gestión de riesgo, esfuerzos como el mecanismo regional para negociación conjunta, las estrategias de comunicación, el mecanismo para fortalecer la capacidad de preparación, mitigación, respuesta. También activamos nuestro mecanismo de asistencia humanitaria, el cual en este momento está siendo actualizado con los ministerios de salud para lograr un abordaje adecuado de la óptica de las amenazas biológicas. Hemos implementado un mecanismo de coordinación entre los sistemas de salud para la vigilancia epidemiológica transfronteriza, actualización también de los protocolos y los mecanismos de coordinación, así como también nuestra plataforma de información y coordinación que nos permite generar pues todos estos escenarios, prever esos escenarios de riesgo y actuar en consecuencia, subrayando también el concepto de continuidad durante la preparación y la implementación de los protocolos de seguridad social frente a la luz del COVID. Como ya lo resaltaba don Ciro, la crisis generada por la pandemia requiere de una capacidad de acción regional complementaria a las acciones nacionales que se han venido emprendiendo en nuestra región, y esta acción regional está caracterizada fundamentalmente por un apoyo complementario a las capacidades de los países miembros del CEPRENA, así como la coordinación con secretarías, instituciones regionales y de cooperación internacional. Estamos desarrollando esfuerzos para vincular la estrategia regional de salud con nuestra política, adaptando también nuestro mecanismo y abordando adecuadamente la amenaza biológica a través de un proceso participativo con los ministerios de salud. Lograr una buena gobernanza del riesgo en estas condiciones es muy complicado. La COVID-19 supuso un incremento exponencial de recursos y demandó un funcionamiento en bloque de los actores estatales, quienes han intensificado su trabajo intersectorial para así asegurar cubrir estos posibles escenarios que surgen debido a la crisis sanitaria. Por cuestiones de tiempo me quedo aquí, pero muchísimas gracias por permitirnos esta oportunidad de compartir nuestros esfuerzos. Muchísimas gracias.
Thank you very much, Claudia, and I do apologize for 7 minutes. Which fortunately, and everybody is keeping to, which will allow us a fair amount of time for questions and answers and maybe a wider interaction even between the panel members. I thank you for the vision from a region that is complex, multi-hazard, one of the regions that suffers most from inequality, marginalization, exclusion in Latin America, and where the complexity of risk is apparent day by day, has been so for many, many years, and with things like the virus and the increase in climate change impacts is likely to be a challenge for the future. With that, I would then pass to our penultimate speaker, Sergio Rico, who is since 2020 the director of the National Emergency System of the Presidency of the Republic of Uruguay. Sergio has a master's in political science, has done studies on strategic forethought, which is really critical in this type of topic, and is a retired colonel, so brings together in his own mindset an interesting series of different approaches to thinking about risk and risk management. Sergio, the floor is yours.
Buenos días a todos los integrantes de esta mesa plenaria. a los organizadores y al público que nos sigue virtualmente. Es para mí un honor representar a mi país en esta exposición y responder las dos interrogantes que nos ha realizado nuestro amigo y profesor Alan Laver. Vamos a hablar primero de la capacidad de respuesta y los mecanismos de coordinación establecidos en nuestra gobernanza. El Sistema Nacional de Emergencias del Uruguay es un sistema público de carácter permanente cuya finalidad es la protección de las personas, los bienes de significación, o sea, las infraestructuras críticas y el medio ambiente. Como pueden apreciar en la imagen, es el Poder Ejecutivo que ejerce la dirección superior del sistema a través de su secretaría. De ahí se desprende la Junta Nacional de Emergencias y Reducción de Riesgos y Desastres, que está integrada por los subsecretarios de los Ministerios de Interior, Defensa, Industria, Energía y Minería, de Transporte y Obras Públicas, de Ambiente, de Vivienda, de Ordenamiento Territorial, de Desarrollo Social y la Oficina de Planeamiento y Presupuesto. También se le suma el presidente o representante del Congreso de Intendentes. Dicha Junta Nacional tiene la responsabilidad, entre otras, de formular las políticas, estrategias, normas, protocolos y planes nacionales para la reducción de riesgos y manejo de situaciones de emergencia. Fue así que el 13 de marzo fue citada por el secretario de la Presidencia para tratar el tema de la pandemia y recibir el informe del Ministerio de Salud Pública. A través de eso, el presidente citó a todos los ministros y sus secretarios para que estuvieran presentes en la reunión que él mismo dirigió, donde se declaró la emergencia sanitaria. Dentro de nuestras normas encontramos a la Dirección Nacional de Emergencias, que tiene, entre otras responsabilidades, la de actuar como nexo entre el Poder Ejecutivo y los demás agentes que componen el sistema, dirigir y coordinar el funcionamiento del sistema a nivel nacional y departamental, respetando la autonomía y competencia de cada institución. Nuestro país está dividido territorialmente en 19 departamentos, como se aprecia en el ángulo inferior derecho, y cada departamento tiene un comité departamental de emergencia presidido por el propio intendente, máxima autoridad. Dicho comité, entre otras responsabilidades, tiene que aprobar las políticas, estrategias, normas, planes y programas, protocolos departamentales sobre la reducción de riesgos y desastres de emergencias en su territorio, en la misma línea que la Junta Nacional de Emergencias y Riesgos. Como verán en la siguiente placa, los comités departamentales de emergencia están integrados como mínimo por los representantes de las reparticiones nacionales que se encuentran en su territorio, el jefe de policía, el jefe de destacamento de bomberos, el jefe de la unidad militar, el representante del Ministerio de Desarrollo Social, de Salud Pública, del Instituto del Niño y del Adolescente y el fiscal departamental designado. Ahora veremos en la próxima placa la segunda pregunta acerca de las lecciones aprendidas. Una de las lecciones principales es que los riesgos y por lo tanto las emergencias pueden llegar a ser globales, como esta pandemia, pero son también multidisciplinarios y multisectoriales. O sea, un sector, como en este caso la salud, es el que predomina en sus efectos y por lo tanto el que predomina en la estrategia utilizada. Pero hay otras disciplinas, otros sectores que también tendrán que llevar a cabo acciones estratégicas en pos del mismo objetivo. La tecnología, la información, las comunicaciones, las TIC, otras de las lecciones aprendidas, es el uso de la TIC, tanto en la colección de información como la comunicación de las mismas. En cuanto a la colección de información, la georreferenciación es fundamental al momento de relevamiento y el del decisor, al mirar el mapa, va a poder tomar mejor sus decisiones. La otra rama de la TIC es la comunicación a la sociedad en su conjunto, del o de los eventos que están ocurriendo, de sus afectaciones. En el caso de la pandemia, los casos positivos, los recuperados, los fallecidos, camas de CTI, estos deben de ser muy cristalinos y de utilidad para la persona que los recibe y accesible a todo público con sus distintas capacidades. Tal vez lo nuevo, lo novedoso en esta pandemia fue el uso de las redes sociales, nuevo canal de suma importancia para transmitir dicha información. Tuvimos la experiencia en nuestro país que los tweets tuvieron una explosión en su visualización. De 0,25 en febrero del 2020 pasó a 15 millones de visitas cada 60 días en el mes pasado. La pandemia provocó la necesidad de utilizar la tecnología para que los estudiantes no perdieran horas de aprendizaje, otra lección que llegó para quedarse. La ciencia. No hay duda que ocupa un lugar sin igual ante una emergencia y más aún ante una pandemia. Nuestro país formó un grupo asesor científico honorario en base a 3 científicos de mucho renombre y a su vez más de 50 expertos con cada uno de ellos, que algunas veces en forma semanal, otras quincenal, se reunían al más alto nivel con el señor presidente de la República y conductor del sistema, a los efectos de tomar las decisiones políticas con argumentos científicos. Los riesgos son sistémicos y también según sus características los territorios pueden llegar a ser transfronterizos. Como verán en esta placa, en la zona norte del país, de nuestra frontera con la República Federativa del Brasil, tenemos varias zonas de frontera seca, sin muros ni alambrados, que algunas ciudades nos separa o nos une una avenida principal, donde diariamente conviven ciudadanos de ambos países, trabajando y viviendo indistintamente de su país de origen, por lo cual ese lugar se transforma en una localidad binacional. Santana do Livramento en Brasil y la ciudad de Rivera, capital de dicho departamento, tuvieron que tomar medidas en conjunto, ya que la pandemia no conocía sus límites, y los pobladores cotidianamente viajaban a un lado y al otro, y a veces en no más de 10 cuadras de distancia. Es así que las autoridades locales tuvieron que tomar medidas espejo en ambos territorios, conjugar esfuerzos para combatir la epidemia con los recursos humanos y materiales en forma conjunta. Tenemos que comenzar a realizar planes binacionales, transfronterizos y ponerlos a prueba, aumentar el relacionamiento con las autoridades de reducción de riesgo de desastres en forma asidua. Muchas gracias por esta oportunidad y esperamos haber sido concretos en cómo manejamos nuestra gobernanza y las lecciones aprendidas.
Thank you so much, Sergio. And you did keep within the 7 minutes. I was going to give you 8 if required. But we're still very much on time. And Sergio has introduced a series of other considerations in terms of transfrontier relationships, which could be seen to be part of regional relationships, but have very specific characteristics at time, and a series of other considerations. I had the privilege of working with Sergio and his group of people at the very beginning of the pandemic up till October last year, and could see the professionalism which was introduced into the topic in the way that the national system dealt with this at the very beginning and later on. So we come in good time to our last but not least speaker, Dr. Wayne Henry, who is the director and chair of the Jamaican Institute for Development Planning. Dr. Henry has a doctorate from, I believe, Ohio State University in development economics, has been present in the banking sector, has worked for the World Bank, and has a vast experience in the topics of development planning, development economics over the years. I'm very glad to welcome you, Dr. Henry, and the floor is yours for the last intervention of this segment of our discussion.
Thank you very much, Alan. And let me say thank you just for the opportunity to share Jamaica's experience. The first case of the COVID-19 virus was confirmed in Jamaica in March 2020. And during the pandemic, many of the government-led interventions were facilitated by existing policies, strategies, legal frameworks, and other arrangements which supported disaster risk management. And these interventions included our national disaster risk management enforcement measures and those orders. The existence of a Disaster Risk Management Act of 2015 formed the basis of many of the government's interventions and actions during the pandemic. We call it the DRMA. It provided the framework for the declaration of the country as a disaster area and provided the context in which the disaster risk management orders were formulated. The order set out rules and regulations for removing or otherwise guarding against the threat or effects of the coronavirus, the COVID-19, and the possible consequences. These included measures such as requirements for entry into the island, directions for persons infected by the virus, guidelines for all persons in public spaces, business, hospitals, infirmaries, etc. It also facilitated the strengthening of the orders with the introduction of fines to cover COVID-19 breaches. We also had the Ministry of Health and Wellness. They had the Risk Communication and Community Engagement Program. And so as a lead entity for the COVID-19 national response, in keeping with the COVID-19 response plan for the health sector, the Ministry of Health and Wellness launched an aggressive risk communication and community engagement program, as well as an enhanced surveillance program, what we call ESP. And this was implemented in accordance with the National Surveillance Policy for Jamaica, which serves to improve the health status of all its citizens by reducing the morbidity and mortality and associated costs of communicable diseases and Class 1 events. These activities are governed by the Public Health Act. The COVID-19 social protection interventions, the crisis elicited a swift social protection response. And the stabilizing effect of the social protection measures, which included cash and in-kind transfers, employment income support, waivers and extensions, among other things, served to alleviate the potential social distress, bolster job retention, cushion immediate basic needs impacts, and encourage consumption. And this was consistent with our social protection strategy, which makes reference to the protection of residents from the worst effects of national or subnational crises, including pandemics. A number of interventions were facilitated under our program of advancement through health and education, or we call our PATH program. And that's our conditional cash transfer program, which provides benefits to poor families who are subject to comply with conditions that promote the development of the human capital of their members. And within the first few months of the outbreak, PATH beneficiaries who normally received a bi-monthly payment received an additional bi-monthly grant, as well as food and care packages. We developed a COVID allocation of resources for employees, the acronym CARE program. And so in light of the impact of the pandemic on the economy and the general population, the government instituted a 31 billion Jamaican dollar, which is about US $200 million stimulus package, consisting of approximately 15 billion in tax cuts and spending stimulus of 16 billion. In addition, health expenditures of 6 billion and public body support of $3 billion made for a total fiscal intervention of approximately $40 billion. And the primary response measure of the Jamaican government was the COVID allocation of resources for employees. And it was a temporary cash transfer program to individuals and businesses, which sought to assist with cushioning the economic impact of the pandemic. And it was further expanded this year with a budgetary allocation of some $5.3 billion. We had some existing coordinating mechanisms which improved our overall response and recovery capacity to the COVID-19 pandemic. And some of the mechanisms included our Office of Disaster Preparedness and Emergency Management, ODPEM, the acronym. They have the National Emergency Operations Center, the NEOC, and that was activated on March 10, 2020, when the first case was confirmed in Jamaica. And they did a number of the initiatives overseeing the response. There's also at the national level, our disaster management program is managed by a National Disaster Risk Management Council, what we call the NDRMC, and 7 committees of that council. The NDRMC is chaired by our Prime Minister, and it's the highest Jamaican disaster planning body. And so our Disaster Preparedness and Emergency Management Agency is the main body within the NDRMC responsible for coordinating the management of various types of disasters. And so the different committees engage. For example, our Humanitarian Assistance Committee prepared a COVID-19 Humanitarian Response Action Plan and escalated response. We also had the Damage and Loss Assessment Core Team. The Recovery Planning Committee is chaired by the Planning Institute of Jamaica, and we led the preparation of a post-disaster needs assessment of the impact of the crisis. And the assessment was carried out by the Damage and Loss Assessment Core Team, which is made up of technical officers from various departments, ministries, and agencies of government with portfolio responsibility for the various sectors. And the team also includes representatives from civil society, from the private sector. There's also the National Emergency Response Geographic Information Systems, which comprises GIS certified volunteers from various government ministries, departments, and agencies. And they maintain a dashboard of indicators that display the current scenario of COVID-19 infections and where persons were located, etc. It's an electronic database and provided real-time information. And finally, we had the National Social Protection Committee, and that's the institutional framework for Jamaica's social protection strategy. One of the main functions of the committee is the provision of a forum for networking and collaboration across programs and projects with a view to advancing a coordinated framework for social protection for sustainable outcomes in income security. And the Social Protection Committee itself comprise various actors and players, including civil society also and the private sector. All right, so thank you very much for this opportunity. Let me adhere to the time restriction. Thank you very much.
Thank you, Doctor. Excellent. You did it again. Everybody, that's the first time I've been in a session where everybody obeyed the 7 minutes. I'd like to think it's because I'm here, but I'm not sure that's not true. Well, thank you very much to everybody that have brought to the forefront a whole series of differentiated considerations in differentiated context. I'm not going to try and summarize this at this moment because I think it is important to get to the questions which have been asked by our audience to the participants. And I will start by reading the questions in the order in which we have passed on to us. You have 2 minutes to answer in order for us to be able to get through one question per person prior to passing on to Vijay to close out with his comments. And so I will begin with the first question I have in front of me, which is for Claudia Herrera, and I will read it in Spanish and English because it is so short. ¿Cómo deben funcionar los sistemas de alerta temprana por amenazas múltiples en un contexto de riesgo sistémico? Well, I think the translation came over, so I don't need to do it. I've got a strange situation where I hear everything at the same time. Claudia, I think if you got that question, could you take the floor?
Hola, ¿me pueden escuchar? Que me sale un mensaje de inicio de audio. Okay,
Y se le escucha bien.
I can turn off the translator, sorry. Wait a minute. Okay. Señor. Lamentablemente, lo siento. Las características geomorfológicas y climáticas de nuestra región se traducen en una gran diversidad de climas y por eso pues nos hace más vulnerable en una región altamente expuesta y por lo cual tenemos que atender adecuadamente todas las amenazas de origen geodinámico, hidrometeorológico. Quiero comentarles que también como lección aprendida del impacto del COVID-19 fuimos desarrollando una serie de acciones para abordar adecuadamente los sistemas de alerta temprana. Hemos desarrollado un diagnóstico de sistema de alerta temprana enfocado en multirriesgo de extremo a extremo que está centrado en la población y que también está fundamentado en la lista de verificación de los sistemas de alerta temprana multirriesgo de la Organización Meteorológica Mundial. Estamos conscientes que la alerta temprana es un elemento fundamental para la gestión integral de riesgo al disminuir las pérdidas de vidas humanas y los impactos económicos y materiales de los desastres, y que el SAT debe de estar comprendido como ese conjunto de capacidades para generar y difundir información de alerta que sea oportuna y sobre todo significativa con el fin de permitir que nuestras comunidades, nuestras organizaciones que están amenazadas por un evento puedan prepararse y actuar de forma apropiada. Es por eso que hemos desarrollado este diagnóstico en el que nos permite también profundizar nuestras acciones en el conocimiento sobre el riesgo de desastres, la detección, la vigilancia, el análisis y la predicción de los peligros y sobre todo las consecuencias posibles. Hemos implementado a través de nuestra plataforma de información y coordinación monitoreos en tiempo real en un esfuerzo conjunto con la NASA, caracterizando también las amenazas, las vulnerabilidades, las susceptibilidades de nuestra región para profundizar también en las capacidades de preparación y respuesta. Estamos organizando nuestro segundo simulacro regional porque también estamos conscientes que además de profundizar en el conocimiento sobre el riesgo de desastre, las principales amenazas que representan pues un peligro para nuestra región, el grado de exposición, también las capacidades y los riesgos, requieren también de funciones y responsabilidades claras para nuestras autoridades y para nuestra población y sobre todo la información de riesgo consolidada que nos permite una detección, una vigilancia, un análisis y un pronóstico, para lo cual, conjunto al desarrollo de la plataforma de información, estamos promoviendo aplicativos regionales que nos permitan tener esa visión de la afectación regional y que también nos ayude a la difusión y la comunicación de los avisos, que ese es nuestro principal reto, la coordinación entre las entidades técnicas científicas y las entidades de gestión integral de riesgo es una de nuestras prioridades. Hacia ahí estamos orientando nuestros esfuerzos a través del desarrollo de innovación, de tecnologías adecuadas para difundir ampliamente y garantizar que nuestra población que está expuesta y vulnerable pueda tener los avisos de forma adecuada y les permita anticiparse a los gobiernos y sobre todo salvar vidas, que es nuestro principal propósito. Muchas gracias.
Thank you, Claudia, for such a complete answer in such a short time. I will now pass over to our second question, which is for Dr. Ciro Ugarte. And it goes as follows. What is the accumulated experience to face new health challenges in the Latin American and Caribbean region?
Thank you for that question. That is an important question that needs a deeper analysis. But I will use the last report that the countries have presented to the regional office of WHO in the Americas regarding the progress in the action plan for disaster risk reduction and emergency preparedness in the Americas. One of the areas that the ministries of health have emphasized for more than 4 decades is that the work in reducing the risk, particularly the risks that are originated in the health sector, are an intergovernmental issue. And this was emphasized in the creation of the Emergency Preparedness and Response program that was established in 1976. But after the earthquake in Mexico and other countries in 1985, the concept of risk reduction was coined in the Americas. And then the Safe Hospitals Initiative, and in 2010, 2011, the concept of smart hospital that is safe and green, and ultimately including several other issues, like, for example, the inclusion of people with disabilities, or also including multi-hazard approach, and several other factors that are related with climate change and adverse events and others have been incorporated into the new area of work of the health sector. But looking for new health hazards is also another perspective. The region in the Americas is one of the most advanced in the world in the capacity to detect new virus or health risks. But then it is we are providing to the world global surveillance system with more than 200,000 samples of for example, of the variants of this virus, and the pandemic influenza surveillance network that has been enhanced for the genomic sequencing in the Americas with many laboratories with in-country capacity to detect the new variants, and also the inter-country work to early response to health emergencies have proved in many occasions that we are better off in detection. The issue is still on how we can use that information and that capacity to control pandemics when they are more than the health sector. It is a multi-sectoral approach, and that is the link that is still to be enhanced in the near future. Thank you.
Thank you very much, Ciro, for bringing into perspectives a series of other considerations, particularly the thing of early warning, which allows, in some way, mitigation pre-impact. And also the whole topic of, which you insinuated but indicated very clearly, of intersectional risk. That is, the combination of varied conditions of human beings, which subjects them to greater vulnerability conditions when faced with a particular hazard, whether a virus or of any other sort. I'll now pass on in the order of the questions which I have on the screen, which is for Dr. Simon. And I'll do this in English. What measures have been identified from the experience of the countries to reduce gender-based violence in the context of emergencies and other pandemics?
Okay, thank you very much for the question. As we all know, the gender-based violence is exacerbated by persons being under stresses, losing jobs, feeling loss of security. And therefore, the major inputs would have to be the protection of the vulnerable. And that was addressed in terms of the social increasing the social security networks in terms of we recognize. So we had persons who came home from cruise ships who were no longer working. And these are persons who initially were significant breadwinners and had significant standing in the communities. So we immediately moved towards providing these persons with some support. Additionally, we increased our mental health and psychosocial support for the communities, for the healthcare providers, recognizing that the uncertainty of the COVID, and then when we added in St. Vincent, the volcano, and even Hurricane Elsa, the greater uncertainty, the farmers could not sell their produce, and so the government set up a program of love boxes, which allowed for the government to buy the foods from the farmers and then give it to those persons who are vulnerable. They set up also the small enterprise support so that persons could continue to sell on their trays because schools were closed, so that persons could not sell on their trays, so that those small income providers, those persons who were not on the national insurance scheme, they were brought onto the scheme. And by producing that support, we were able to, we think, identify and to protect those persons who might be at increased vulnerability to gender-based violence. In the shelters, we also focus a lot on keeping the families together, and in terms of being in the shelters for the volcano, in the shelters providing psychosocial support so we could there was early identification when somebody was at risk. So I think it is a lot of the as we say in disaster management, you have your systems which are in place, but also you identify what is going to trigger. And so you put supports in place to try to prevent, and if not prevent, to be able to respond as quickly as possible. I'm not sure if that's sufficient.
Thank you so much, Doctor. And again, raising an issue that has been on the books for many years in different disaster contexts, which comes to the forefront as we've read often in the current COVID situation in many parts of the world. I will now pass then on to Coronel Rico with an interesting question which does remit to public confidence, I guess. Y dice, ¿cómo fortalecer la gobernanza del riesgo cuando las autoridades a nivel nacional pueden ocultar la información de lo que está ocurriendo con la COVID-19.
Gracias, Ale. Pregunta muy interesante. En el caso de nuestro país, tenemos una política nacional de reducción de riesgos y desastres, un plan nacional de reducción de riesgos y desastres que sale en estos días, y ambas tienen en cuenta nuestra ley de información pública, que es fundamental para que todo ciudadano pueda requerir cualquier tipo de información al Estado en cualquier momento. Y el Estado tiene un tiempo prudencial para responderle a ese ciudadano. Entonces, para no llegar a ese punto, toda la información en cualquier emergencia, ya sea el COVID, una inundación, viento fuerte, déficit hídrico, incendio forestal, se le tiene que dar al ciudadano en forma cristalina, honesta y lo más pronto posible. Creo que en eso se basa un poco la buena gestión que tuvo nuestro país, en la institucionalidad que tiene el Estado. Y la institucionalidad se ejerce, se forma por la honestidad y la credibilidad que tiene un gobierno. A su vez, nuestro sistema nacional de emergencia tiene lo que se llama un MIRA, que es el Mirador Integral de Riesgos y Afectaciones, donde de distintas instituciones públicas, ministerios, entes, van cargando la información de cualquier riesgo o afectación. Esta aplicación las junta geográficamente, georreferenciadas, y ahí cualquier ciudadano puede ver ante distintos visualizadores cualquier tipo de emergencia. Por suerte, esta aplicación que se había comenzado a realizar en el año 2019, con la llegada de la pandemia en el 2020, con una importante inyección de capital y la colaboración de empresas privadas, se le hizo muchas herramientas a esta aplicación y pudimos tener al instante todos los casos positivos georreferenciados, las personas recuperadas, las personas lamentablemente fallecidas, las camas en los CTI, y todo estaba público. Hasta hoy en día sigue estando público en nuestro monitor de camas ocupadas en los hospitales. O sea que aquí por lo menos no se ha ocultado información al público, y creo que es fundamental para un gobierno no ocultar esa información, porque nos debemos al bienestar del público, y el público tiene todo el derecho del mundo a conocer lo que está pasando a su alrededor, porque es una forma también de protegerse a sí mismo y proteger a los demás. Así que no sé si por ahí está respondida la pregunta.
Thank you very much, Sergio. I think you did. I think it raises a very important point which goes beyond the limits of the question. I know that academic researchers, for instance, question why information on climate patterns, which is in official organizations, is not immediately accessible to researchers and the public, and you have to pay for it. Such things as the right to information, the right to participation are very clear subjects which we could go on about for a long time. Thank you very much, Colonel. And now to Dr. Henry, and I'll ask this question in English. Which is the contribution of geospatial information in disaster risk management governance?
All right, thank you. Thank you very much. We have utilized geospatial information systems heavily in the response to the COVID crisis, and then in the broad general framework of disaster management in Jamaica. We've been including risk management and information systems more prominently. I spoke of the National Emergency Response Geographic Information Systems, what we call our NERGIST team, and that's coordinated by our Office of Disaster Preparedness and Emergency Management. and the National Spatial Data Management Branch. And we said that comprises some GIS experts, GIS certified volunteers from the various ministries, departments, and agencies of government. They've maintained a dashboard that would display current information and the situation on the COVID-19 pandemic. We had an electronic database of records that was also prepared using information that would come from our Ministry of Health and Wellness. Records include suspected and confirmed cases, close contact persons, deaths, unfortunately, of course, and recoveries, source areas, whether imported or locally, and status of quarantine and isolation facilities. So quite a bit of information through our GIS system. We provided support to the Ministry of Health and Wellness through the development of map products, including classified information that needed to be represented spatially. So that was important as we were mapping the areas of the country and giving policy advice to help to manage the spread of the pandemic. The team used GIS and related technology to generate boundary maps for designated quarantine areas, COVID-19 case maps, and the mapping of other critical facilities, such as the distribution centers managed by our civil society organizations. So extensive use. We Jamaicans, it has been participating in a pilot on a coalition of climate resilient investments, CCRI, where we've developed with help from the University of Oxford and the CCRI Secretariat and help from the Green Climate Fund, the GCF. We've developed a systemic risk assessment tool where we are able to infuse risk components and risk exposure components in our infrastructure development of the country. So that promises to be extremely useful, where we are able to map and give risk aspects and risk components to our basic infrastructure in the country as we map the country's assets, and that will help in the financing implications of our infrastructure. So we think that's extremely useful. So we are seeing more risk assessment coming into the planning framework. We are seeing more forward thinking, more trying to anticipate futures as we begin to build resilience in our overall risk management apparatus in the country. Thank you for the question.
Thank you, Doctor. In order to give the due time to Vijay at the end of his session, I will take one more question or ask one more question, which will be a question to the community there, of which one of you will have the opportunity to reply. So don't fight over it, but please talk if you have something significant, as you will have to say. The question which is asked to all of the panelists is, what great lessons could you share about this pandemic in relation to disaster risk management, which will allow us to manage better in the future? So that's a question which maybe somebody could raise their hand, and the first person to raise their hand we will take, and they will have 1 minute and 40 seconds to reply. I see no hands. Dr. Henry, thank you very much.
So thank you very much, Alan. Thank you for that question. And I don't want to take all the time. So if my colleague panelists want to share also, but many lessons thrown up and shown by the pandemic. One is, of course, the need for mechanisms to be in place. You can't wait for the crisis to come and then you are now trying to react. So the need to be proactive, very important. I think the need for information sharing, in a time of crisis, credibility, trust is important, and the information that is shared to allow for collaboration of the various actors. No one entity can do it by themselves. And so as information is shared, it allows collaboration and buy-in and to know what is happening. I think that's very important. And I think the lesson of technology infusion, that we have, those technology-enabled mechanisms, because in the nature of this particular pandemic had been where you want to encourage distancing, social distancing, You want to minimize the movement of people and the gathering of people. But then if you have to do social transfers, if you have to engage in community spaces, then the technology would have allowed you to do that without putting lives at risk or violating the distancing protocols, etc. So the efficiencies brought about by technology we found to be extremely useful. As we had to move educational service delivery online for a schooling system, then we realized the importance of technology. So many lessons, but I'll just highlight those three. Thank you.
Perfect, and thank you, Wayne. We do not have time for another question. I want to give the full time to Vijay Kumar, who is the Executive Director of the Global Network for Civil Society Disaster Risk Reduction, probably the oldest and largest of the organizations in the world. I think it's over 1,000 members now, probably more than 100 countries involved. And so I will give the word to Vijay to give us some final comments and in his 4 minute space, and I will have 30 seconds to close out everything. Vijay, the floor is yours.
Thanks a lot, Dr. Alan. It's my privilege to be part of this group of panel, and I had the privilege to listen to you and learn from you. My name is Vijay Kumar, as Dr. Alan has introduced me. I represent Global Network of Civil Society Organizations. We are a network of 1,600 plus organizations, and 1/4 of those members come from Latin America, Americas, and the Caribbean region. And it is a real learning to listen to you. Let me just capture what I learned. The first one that I learned, that the global pandemic was global in nature, but impact was local. So that all of us will know that. This is what we learned from the pandemic. The second thing we actually learned, which was also underlined by Dr. Simone in her response, that like other disasters, these also had a disproportionate impact on the people. People who are vulnerable, they were exposed to this more. Women, person with disabilities, the elderly population, they were disproportionately impacted, as it happens with most of the disasters. And number three, that we could actually very clearly see the systemic linkages, the concomitant relationship. If one is poor, then they were impacted more. If the country was poorer, then they didn't get the vaccines. So let's say it had a concomitant relationship. But more importantly, the systemic relationship also resulted in bringing it a multi-hazard linked processes. So there are other hazards which also compounded the problems. And the last but not the least, that as Dr. Henry was saying, that we saw that it is a collective efforts that actually took all of us together, and technology was overused. Now, in terms of what the solutions that I heard from your thinking, I will quickly touch upon the 5 solutions that I captured. The first, let's not forget to capture the analysis of the risk from the perspective of the community which is living that risk. So it is more important now, go to those areas, the local areas, local capacities need to be thought through. And we need to listen to the perspective of the communities who are living these experiences. Number 2, as actually it was Dr. Paula, Dr. from Chile, she actually articulated it very clearly, that there is a need for strengthening the local capacity, recognizing the local capacity, and trying to see how you actually bring the collective perspectives so that the private sector, the civil society organizations, the scientists or scientific community, academics, they can work together at the local level. So that is the collective process. Number 3, that it was essential that local capacity need to be taking on board the plans of the communities for building resilience. What actually Claudia actually talked of. Dr. Claudia talked of that fundamental thing is building the resilience of the communities most at risk. How can we all come together to build that resilience, which is actually important. So that is what we need to orient it to the involvement of the communities most at risk, but they don't have the solutions for everything. They need to work with others, that it is essential that solution is also informed by the various other actors who are involved there. They're involved in planning, they're involved in implementation, they're also making the other actors accountable. Number 4 is actually strengthening the national coordination mechanism. As Dr. Simon actually talked of the HACE as an example of national coordination. And Sergio Rico talked about the structure how you put that. And Dr. Henry actually talked about the structure, how you put it and actually work at the national level, which actually is coordination of the responses. And the last, before I give it to Dr. Alan, is at the global, at the regional level, as Claudia was talking of, that you have to think beyond the countries and see how you can bring it together. I will actually put it not only region, at a global level, share, learn, and be effective. Thank you very much, Alan. Thanks a lot.
Thank you very much, Vijay. We have 12 seconds to the planned finalization. Excellent. I would just highlight two things from all of this: the need for prospective management, that is, avoiding this in the future. We've learned from the COVID experience what was gone wrong with our planning systems, with our structures, with our development processes, and we can do something about that in the future. And the other is the integration across spatial scales, where local is absolutely fundamental, but we must realize that most risks at the local level is related to something that happens somewhere else, and it's out of the capacity of local authorities to deal with national land planning schemes, etc. Very short, my thanks, immense thanks to the organizers, to the participants. Thank you very much. Have a good day. And I guess we're celebrating the end of the platform meeting today. Thank you to Jamaica for all of the effort put into this. And let's hope to see you in Jamaica the next time. Thank you very much. And good morning, good afternoon, good evening.
Thank you very much. Thanks a lot.
Muchísimas gracias, Dr. Alan Lavelle, Coordinator, Social Studies, Risks and Disasters Program, Latin American Faculty of Social Science, Flaxo, Costa Rica. I thought he did a fantastic job as moderator, very engaging session. And, I like what he said, hopefully we'll be able to host all of the moderators and speakers another time right here in Jamaica in person. Now, I have a couple of announcements, but before I do so, I'd like to take the opportunity to acknowledge the presence of the Honorable Desmond Mackenzie, Minister of Local Government and Rural Development. Congratulations are in order, sir, to you and your team. Simply standing here with pride, Jamaica being the first Caribbean country to host RP. It's a big deal. Now, for the viewers out there who may not have the pleasure of viewing the minister, there are two things you need to know about him. One, he is the quintessential patriot. So he is donning his Jamaican colors, his flag. He has his green lapel. He has his pocket square. He has his green mask. The second thing you need to know about him is that he's a Manchester United. We all do make mistakes. As you can see, as I stand here at the lectern, I am rocking my blue and white, which means that I proudly stand as a Chelsea fan. Hey! Thank you so very much. This is day 4. It's the final day. We certainly wish that we could have these conversations, 5 days, 6 days, but certainly it has been quite a fantastic event over the last 4 days. So these are the two reminders, two announcements. The sessions will be available on UNDRR YouTube channel in case you missed a session or two, or perhaps you would like to rewatch the sessions. Again, they will be available on the UNDRR YouTube channel. The other announcement is that today we will have the closing ceremony of the media training Saving Lives, and that will take place at 11:30 a.m. Access is available on Hopin, and all you have to do is directly click on the schedule, and it is open to the public. I take the opportunity to thank all the journalists and all the members of the media fraternity who registered, participated, and are leaving this event more informed and mindful when framing these conversations. We'll be back at 11 o'clock after this very short coffee break.